The basic thing is when we perform breast reconstruction, there are two things we have to replace because during a mastectomy, you remove the skin, you remove the volume, which is a breast tissue. So when we do an expander implant reconstruction, I tell the patient that the first thing is this is a two-stage process. The first part is putting in the expander, and over. This is an example of a breast tissue expander, right? And what it does is it has a special port there, so when we put it in, it's partially inflated or in fact deflated. And once the wound is healed, a few weeks later, we start going through the port and injecting it and putting in fluid, and gradually it will stretch and expand, and by then it will start stretching the patient's skin. This usually takes anywhere from 3 to 6 months. And sometimes, for most part, we also overexpand it to overstretch the skin because the skin is very elastic. At the second operation, done as an outpatient, we take out the expander and then we replace it now with an implant. And this is an example of a silicone implant. And what I do is prior to the replacement procedure, I make it a point that I discuss this with a patient, the difference between a saline implant and a silicone implant. And it is the patient's choice whether they want to replace the expander with a saline implant or a silicone implant. And most would opt for a silicone implant mainly because it has a much better feel. So to summarize, when we do an expander implant reconstruction, it is a two-stage process. And the first stage is done during our 3-hour protocol. We let the patient heal. We do the expansion process, and then we do the replacement several months later.